Hello everyone, I welcome you all on my YouTube channel Pathshala by Dr. Rohit Sharma. Today's topic is on necrosis. It is a very important topic as it lays down the foundation of many pathologies. First of all, we'll talk about the definition of necrosis. Where exactly this word came from? It is a Greek term that is nekros, which means death. So necrosis is nothing but a form of cell death. Moving on to its causes. So necrosis can occur because of lack of oxygen, physical trauma, or any microbes like bacteria, viruses, fungi, any chemical. It may be because of any thermal injury, because of radiations and electric injury. So this is something a normal cell looks like. A normal cell is comprising of a cytoplasm that is outside and a nucleus which is in the center of the cell. Whenever there is decrease in the size of a normal cell, it is called as atrophy. Whenever the number of cells increases, it is known as hyperplasia. If the size of a cell increase, not the number, is the size of the cell which is getting increased in this case, that is known as hypertrophy. So what is the difference between hyperplasia and hypertrophy? In hyperplasia, there will be increase in the number of cells, whereas in hypertrophy, there will be increase in the size of the cell. As you can see in this image, the size of the cell is increasing in this image. Another thing is metaplasia, when a cell form is converted into another cell form. A cell type, that is example, if a squamous cell gets converted into a columnar cell or a cuboidal cell, then we call it as a metaplasia. And another term is dysplasia, that is disordered growth of cell is known as dysplasia. And all of them, atrophy, hyperplasia, hypertrophy, metaplasia and dysplasia, all together known as cellular adaptation. When these cellular adaptations occur in a normal cell, whenever there is a stimulus, any form of injurious stimuli, when it irritates the normal cell, then this normal cell may undergo cellular adaptations in the form of atrophy or hyperplasia or hypertrophy or metaplasia or dysplasia. But if the injury continues, then this normal cell will undergo necrosis. Now let's talk about the pathogenesis of necrosis. If suppose this is a normal cell, if necrosis happens, the cell will swell up in size. It will be increase in the size of the cell. And after cell swelling, there will be disruption of cell membrane. If you can see in this image, the cellular membrane gets disrupted. And after the disruption of cellular membrane, there will be leakage of cellular enzymes. And accumulation of inflammatory cells will also occur. Which is the most common enzyme? In this case, it will be lysozyme. This is a very important MCQ that has been asked in many previous examinations as well. Let's talk about the biochemical mechanisms of necrosis. There will be decrease in oxygen supply. Necrosis occurs because of ischemia or reduced oxygen supply. Because of this reduced oxygen supply, there will be mitochondrial damage. And if you all know that the mitochondria is the powerhouse of the cell, what happens in mitochondria? There will be generation of ATP. And suppose the mitochondria is damaged, so there will be no ATP. So what happens? There will be depletion of ATP. And because of depletion of ATP, there will be no energy. Secondly, what happens? Because of the plasma membrane rupture or lysosomal membrane rupture, there will be leakage of enzymes. And what enzyme is the most important enzyme in this? As we have already discussed in the previous slide, that is lysozyme. Thirdly, there will be reactive oxygen species which will cause damage, direct damage to proteins, lipids and nucleic acids. So this is the biochemical mechanism behind any necrosis. So let's discuss the morphological changes in necrosis. We have some cytoplasmic changes and some nuclear changes. But before discussing this cytoplasmic and nuclear changes of necrosis, we are going to discuss hematoxylin and eosin stain. In hematoxylin and eosin stain, we have two stains. One is hematoxylin and another one is eosin. Eosin is acidic and hematoxylin is basic. So, because eosin is acidic, it is going to stain the basic structure. And basic structure is in the proteins of cytoplasm. It is going to stain the cytoplasm pink. Similarly, we have hematoxylin. Hematoxylin is a basic stain. So basic stain is going to pick acidic component of the cell. And acidic component of the cell is inside the nucleus. That is nucleic acid. That is why hematoxylin is going to stain the nucleus blue. Now we are going to discuss the cytoplasmic changes and nuclear changes individually. In cytoplasmic changes, we have increased eosinophilia. It means the cell will appear more pink in color. Secondly, we have glassy homogeneous appearance because there will be loss of glycogen particles. And these glycogen particles were staining lighter. So because of the loss of these glycogen particles, the stain will be more pink in color. It will be more increased eosinophilia. And the enzymes which were leaked out of the cell, they will eat all the cytoplasmic organelles, and this appearance is called as moth-eaten appearance. Another potential MCQ, this moth-eaten appearance is characteristic of necrosis. And we have appearance of myelin figures. Another MCQ that has been asked many a times, that myelin figures is a characteristic finding of necrosis. This is a picture showing necrosis. There is increased eosinophilia in this, and we can see the moth-eaten appearance as well. In nuclear changes, we have three nuclear changes that have been described in necrosis. One is pycnosis. What happens in pycnosis? There will be nuclear shrinkage. As you can see in this image, we have a normal nucleus on the left side, and on the right side that nucleus got shrink. This is a pycnosis. Secondly, we have karyorrhexis. Karyorrhexis is known as nuclear fragmentation. So you can see the fragments of nucleus in karyorrhexis. And third is karyolysis, where the whole of nucleus fades away. This is an image of karyolysis. So these are the nuclear changes which are very characteristic of necrosis. One is pycnosis, then karyorrhexis, then karyolysis. Now suppose if a cell has undergone necrosis, what will happen to the necrotic cell? So it will be digested by enzymes and disappear, or may get calcified. And this calcification of any necrotic cell is known as dystrophic calcification. So what are the types of necrosis? We have 5 types of necrosis. One is coagulative, second liquefactive, then caseous necrosis, fat necrosis, and fibrinoid necrosis. So first we will discuss about coagulative necrosis. So the main cause of coagulative necrosis is ischemia or lack of oxygen. So whenever there will be ischemia in all the solid organs, it may lead to coagulative necrosis, except brain. In coagulative necrosis, the cell architecture is well preserved. There will be loss of nucleus. As we have discussed, the nucleus will undergo pycnosis, karyorrhexis, and karyolysis, and ultimately nucleus fades away. But the cell architecture is preserved in case of coagulative necrosis. And the necrotic tissue or the necrotic debris is surrounded by inflammatory cells like neutrophils and macrophages. This is an image of kidney. On the upper side, we can see a whitish yellowish necrotic area, and in H&D stained image, we have a blue colored star showing normal glomerulus, and a green colored star is showing the tubules of kidney. So in the glomerulus as well as in the tubules, we can see the cytoplasm, that is pink in color, and nucleus as well, that is blue in color. But on the right side of this image, if you see very keenly, then you are going to visualize that there is no nucleus on the right side in the tubules. There is a yellow star mark. This is a tubule which is having only cytoplasm. So the nucleus fades away in case of necrosis, but the cytoplasmic architecture is preserved in case of coagulative necrosis. And whatever blue structure you are seeing in this image on the right side is nothing but inflammatory cells, that is neutrophils and macrophages. But the tubules on the right side, you can easily see there is no nucleus in these tubules. That is just cytoplasm. In liquefactive necrosis, the cause is infections. Any bacterial infections and few fungal infections also may cause liquefactive necrosis. What happens exactly? Because of the microbes, there will be accumulation of inflammatory cells. And these inflammatory cells are going to secrete some enzymes. Example, lysozyme. So these enzymes will digest and liquefy the necrotic tissue. Hence the name came liquefactive, because there will be liquefaction of the necrotic tissue. And this liquid material, this creamy yellow necrotic liquid material, because of acute inflammation, is known as pus. Now this is an image of a brain which is showing liquefactive necrosis. As you can see on the upper portion of the brain, there is dissolution of tissue, and this necrotic tissue is somewhere somehow it appears liquefied. Now caseous necrosis. What is caseous? Caseous is cheese-like. Why we call it as a cheese-like? Because it gives us friable yellowish whitish appearance, as you can see in the image on the right top corner of this slide. On microscopy, it looks like amorphous granular pink dead cells. This is an image of microscopic picture of caseous necrosis. In the center, we have this amorphous pinkish material, that is caseous necrosis, which is surrounded by epithelioid macrophages, lymphocytes, and Langerhans type of giant cells. This whole structure, which carries caseous necrosis, epithelioid macrophages, lymphocytes, and Langerhans type of giant cell, this whole structure is known as granuloma, which is a characteristic finding in tuberculosis. Now moving on to fat necrosis. The main cause of fat necrosis is acute pancreatitis. Pancreas is comprising of enzymes like lipase, trypsinase, chymotrypsinase. So whenever there is a pathology of pancreas, these lipases gets activated and released in the pancreas, in the peritoneum, and ultimately it will destruct the fat. So that's how this fat necrosis occur. What happens? In fat cells, we have triglyceride esters, and because of these activated lipases, these triglyceride esters get converted to fatty acids and calcium. Grossly, because of calcium, they look like chalky white areas. As you can see in this image on the left side, we have chalky white deposits in the peritoneum. This is an image of omentum with chalky white areas, and on the right side we have a microscopic image of fat necrosis, which is showing shadowy outlines of necrotic fat cells which is surrounded by inflammatory cells. Now moving on to the last type, that is fibrinoid necrosis. Fibrinoid necrosis, the main cause of fibrinoid necrosis is antigen antibody immune complex deposition in the walls of any vessel. Because of these deposition of antigen antibody immune complexes, it looks like fibrin, and fibrin on H&E stain looks bright pink amorphous. That's how this name came up, fibrinoid, that is fibrin like. The example is polyarteritis nodosa. It is a pathology of vessel where these immune complex get deposited in the vessel wall and appears bright pink in color on H&E stain. This is an image. As you can see, many red colored RBCs in the center. This is a vessel comprising having these RBCs in the center, and the surrounding vessel wall is appearing bright pink in color. But you cannot appreciate any nuclei in them because it is a necrosed vessel wall. This is a type of fibrinoid necrosis. Now here I am going to give you some extra knowledge so that you are going to like and share this video and subscribe my channel. Whenever there is damage to the cell membrane, there is leakage of intracellular proteins, and these intracellular proteins come up in the blood circulation as well. So if we test blood, we can detect these intracellular proteins in the blood serum sample. So these intracellular proteins can be used as useful markers for tissue specific damage. Example I'm going to give you here. Example is CKMB and troponin. CKMB and troponin are two investigations that have been done in a patient of myocardial infarction. Whenever there is myocardial infarction, this infarcted or necrotic tissue is going to secrete CKMB and troponin in the blood circulation that can be detected by the machines in the laboratory. Another example is hepatic bile duct necrosis. What happens in hepatic bile duct necrosis? These cells are going to release alkaline phosphatase that can be detected in the blood or serum sample. And in case of hepatocyte necrosis, we are going to detect transaminase in the blood samples. Another thing I am going to discuss in this is gangrene. So few books cover gangrene in necrosis only. Few books says that no, gangrene is altogether a different chapter. But I'm going to tell you gangrene is nothing but a type of necrosis only, where the necrosis is going to happen in the extremities and because of severe ischemia. So it is a type of necrosis where necrosis is happening at different tissue planes. We have two types of gangrene. One is dry gangrene and one is wet gangrene. Dry gangrene is a type of coagulative necrosis and wet gangrene is a type of liquefactive necrosis. But I am going to cover gangrene as a whole in a different video. Thank you all of you for watching this video and wish you all and your families a very happy new year 2024. Do not forget to like this video, share this video and subscribe my channel. Thank you.